Good afternoon, and welcome to the first virtual Talks at Pulitzer. I am Ann Peters, our University and Community Outreach Director for the Pulitzer Center, and it's a pleasure to have with us today Dr. Seema Yasmin to kick off our series on science and health. And as we're waiting for more folks to join us today, feel free to let us know in our chat room where you're joining us from so we can see who will be in this conversation with us today. We're from Delaware, I see. We have folks joining us from Montreal, Oakland, California. So another Oakland, California, Reno, New York City, DC, Florida, Madrid. It's really great to see so many folks coming together with us. Pakistan, Maryland, Stockholm. It's really a pleasure to see that these connections are far and wide, from Kenya to Barcelona, India, Philadelphia. So thank you all. You can keep letting us know where you're connecting from with us today. I wanted to give us an introduction about Dr. Yasmin. She's the director of the Stanford Health Communication Initiative. She is both a medical doctor and a multimedia journalist. She has done a stint in the Epidemic Intelligence Service in the CDC. She is also a poet, and among her books, the forthcoming If God is a Virus, the Ebola poems that combines Pulitzer Center supported reporting from West Africa with poetry to tell the stories of Ebola survivors and responders. Dr. Yasmin's work is a great example of why the Pulitzer Center does what it does, providing support to journalists around the globe, many with key expertise in areas they are reporting on, to uncover often overlooked issues, as well as dig more deeply behind the headlines. The Pulitzer Center started out in 2006, supporting 9 projects then. Last year, we approved more than 180 projects from professional journalists and 43 reporting fellows from our campus consortium partner schools completed projects in 29 countries. On the education front, we reach thousands of students and educators each year via class visits, online sessions, professional development opportunities for teachers, and university events with our journalist grantees and education staff. And then, of course, there are the public events like today's session. 2 reporting initiatives I want to highlight for our audience, especially those journalists listening in with us today: our Coronavirus News Collaboration Challenge and our Bringing Stories Home local reporting grants. At a time of scarce media resources, the coronavirus story challenges newsrooms to find creative ways to bring accurate, compelling, and timely information to the public and to policymakers. We're eager to hear from journalists with proposals that involve strategic and concerted efforts to pursue reporting together, leveraging their resources, and aiming to expand the impact of their work. So that's the collaboration challenge for journalists anywhere in the world. Through our Bringing Stories Home initiative, we're eager to help U.S. newsrooms in particular to cover a range of stories. With the Bringing Stories Home initiative, we're focused on outlets serving U.S. cities outside of those in the larger metropolitan areas across the country. For more information, please visit pulitzercenter.org. Now, a few housekeeping matters before we move on to the main event today. Dr. Yasmin will speak for about 20 minutes. We'll then have time to answer some of your questions during our Q&A, and you'll see a Q&A icon on your screen. You can begin adding your questions there throughout her presentation, so please go ahead and do that. There's also a chat icon on your screen, and we'd appreciate if you use that, besides letting us know where you're from, to ask any more specific technology questions you might have if you're not able to hear us, for example, and you need some assistance. But note that all attendees are muted. We'll also have time throughout the session to hear from you with some questions in a poll to get your thoughts on particular topics that we're addressing. We also want to let you know that we'll be recording the session today to post it online for others who could not join us. And one final housekeeping matter, please remember to stay online once this session ends to participate in a brief survey to help us better serve your interests. And now we'll turn to Dr. Yasmin, who will talk to us today about how journalists fit into the public health ecosystem, especially in these times, and how journalists can do better in focusing in on more vulnerable and marginalized communities whose stories often go untold. Please welcome Dr. Seema Yasmin.
Thank you so much for that great introduction, Anne. And thank you to the team behind the scenes at the Pulitzer Center, including Holly and Peterson and others who have made this session possible. And I was just looking at the chat and seeing all the places that we are joining from. I am talking to you now from the Bay Area in California. And it's really heartening, I think, at a time of physical distancing to think about this connected conversation we're having with folks in Rwanda, Brazil, Peru, and other places. So thank you for making time. And thanks to the Pulitzer Center for facilitating a conversation about journalism in such a challenging time. I think we're all pretty aware that we're in a public health crisis, but we're also in a crisis in terms of journalism and the state of journalism. And it's not a new crisis, but I think that this global health challenge that we're going through is exacerbating some of these issues within journalism. So I'm going to be talking about the role of journalism during a pandemic, and then the particular challenges that journalists face when reporting on public health issues. I'm happy to say that this is an interactive session, as Anne mentioned, so we'll definitely have time for the Q&A after I finish speaking in about 20 minutes. Please put down your questions now and keep them coming. But also, as I talk on these issues, I am going to pose 3 questions to you in total throughout my talk. And I'm really excited to engage with you and see what your responses are to some of these issues. Anne did a really nice job of introducing me. I wanted to elaborate a little bit on it to kind of explain to you where I'm coming from in terms of understanding this intersection of journalism and of public health. So I trained as a public health physician. I was an officer in the Epidemic Intelligence Service, and my job was to respond directly to epidemics. So I'd be sent to where disease was spreading, and my role was very much to contain the infection, to try and keep as many people as safe as possible, and to figure out what disease was spreading and how it was doing so. Something that I noticed every single time was that the disease was not spreading in isolation. There was also information spreading alongside it. Sometimes that would be accurate information that was helping to keep communities safe, and other times it was misinformation. And it was at that time, when I was going into these epidemic areas as an officer in the Epidemic Intelligence Service, that it really struck home for me that journalism is part of the public health ecosystem. And I felt that that point was my aha moment, that if I wanted to be a really effective public health physician, I needed to train as a journalist. Partly that was my own drive, because I always like to be that person that's at the center of a crisis, figuring out what's happening, trying to find out ways to keep people informed and to keep them safe. So there's this natural alignment, I think, between public health and journalism. And in fact, I was really frustrated often when I was working at the CDC that I'd be sent to investigate the spread of disease and almost told to ignore the fact that there was misinformation, myths, and hoaxes that were spreading, as if that didn't impact the public as much as the disease. It very much did. And in fact, that spread of misinformation and disinformation can accelerate and fuel the spread of infection. We're seeing that now with the pandemic, where there are communities that are vulnerable to infection, but there are conspiracy theories milling around, almost telling people that some communities are immune to the new coronavirus, which isn't true. So at the point that I decided that journalism was a really important part of the public health ecosystem, that was when I went to train as a journalist. And before I talk any more about the way that public health and journalism intersect and can really work together, I want to put this question to you for our first interactive poll. And my question is, do you think that journalism contributes positively to the public health ecosystem? Few options there, and I'll give you half a minute. And feel free to add any additional thoughts into the chat session as well. I'm not exactly timing half a minute, but I'll count down in a second. I'm not going to vote because I feel like you already know how I would vote. Maybe 5 more seconds. If I count us down, 5, 4, 3, 2, 1. Yeah, and I can see in the chat all these things, all these caveats are popping up, right, depending on who's telling the story. But it looks like the vast majority, so like more than 2/3 of us say that, yeah, journalism does contribute positively. I certainly feel like it can do, and I feel that journalism plays this very important role. I'll give you one example. When I was in the Epidemic Intelligence Service, I was sent to investigate an outbreak of flesh-eating bacteria in an American Indian reservation, a very, very large one in the United States, or it's a sovereign nation within the States. And it was a terrible epidemic. And as I was doing all of my epidemiology work to figure out how was this infection spreading and why was it causing such severe disease, people were dying, people were losing their limbs, I quickly became aware that as technically advanced as my investigation might be, the very reason that this bacteria was killing people in this American Indian reservation was because there wasn't access to clean water. I was saying to people, you know, while this epidemic is spreading, make sure you're washing your hands with soap and water. People were saying to me, with what water? And I wasn't aware, as somebody that was new to the States, that there wasn't running water on this huge reservation where tens of thousands of indigenous people lived. That was also one of my aha moments, because I thought at the end of this investigation, I'll do my best to contain the outbreak, to try and keep people safe. But when it's all said and done, I'm going to write up my report and it's going to get published in a scientific or a medical journal that very few people are going to read. And the first word in the term public health is public. So where was that engagement with people to show and raise awareness that these are diseases that are spreading in the US because of a lack of access to the most basic resources? And so I felt that journalists played a critical role there in explaining how public health works. What is the role of public health workers? How can we all in our communities be better informed to keep ourselves safe and healthy? And that's certainly being demonstrated now with the coronavirus pandemic, where there is so much information circulating, and we're dealing with a brand new virus that we didn't know existed until the end of December of 2019. And as quickly as this new information is developing, we're learning about the virus's genes, its proteins, the way it spreads. Just yesterday, a new report came out about the antibodies that we develop in response to the infection and how long those may or may not last. As quickly as that's developing, there's a need for journalists to get that information out to the public in a way that's accessible, understandable, and reaches the people who need it most, because there are health disparities that we know about. In the States and other parts of the world, there are areas that we define as health deserts, places where there's inadequate access to even the most basic medical care. And what I have noticed, and I would love to do a proper study of this, is that when you kind of look at the areas where there are health deserts, there are often news deserts there too. And news deserts, I don't think anyone's defined that term as technically as we have with things like health deserts or food deserts. But to my mind, I think of news deserts as places where residents do not have access to local news, where local news organizations maybe did used to exist, but were decimated, were not able to sustain their business. So that brings me to my next point, which is that at a time of a public health crisis, when we need information and accurate, accessible information more than any other time, arguably, we need to make sure that we have journalists who are well trained, who are adequately supported, who know how to report on issues to do with science and health, because they are really our frontline workers in a way as much as medical workers are. We need those journalists to hold the powerful to account, to help us understand whether our leaders are doing their job, whether they are making sure that healthcare workers are supported, that there's enough equipment, all those kinds of things. And we also need journalists to help counter some of that misinformation that's spreading. So this leads me to my next question for you. And this question is, do you think that journalism organizations are doing a good job taking care of employees during a health crisis? And I'll explain the backstory of why I'm asking you this question in a second. Okay, I'll count us down so we can get through this. 5, 4, 3, 2, 1. Very curious what you think about this question. More than half of you are on the fence about this one, so maybe not such strong feelings. So the reason I ask this question is because in 2017, I left the newsroom. I was a reporter at the Dallas Morning News. I'd left the newsroom to come to Stanford to do a fellowship here in journalism that's called the John S. Knight Fellowship, or JSK. And for journalists who are watching this, and I hope many of you are journalists from around the world, this is a really wonderful fellowship, which I encourage you to look up, because it gives you time out of the newsroom to go in depth to explore a challenge in the journalism field. So I came to Stanford in 2017, 3 years before this pandemic, with this very question, that how can we better support journalists to report on epidemics and pandemics? And I knew that the more that we support journalists, the better that we protect the public, the better we get good information out there and counter the false narratives. And so many of you are neutral, but if I was voting for this poll, I would say I disagree. 1% of you strongly disagree. Maybe I would join you in that minority, because what I learned during that year at Stanford when I was doing my research, I interviewed editors and reporters at organizations around the world, mainly focusing on how Ebola and Zika epidemics were covered in the press. And I learned that journalists did not feel adequately supported and resourced during their coverage of an epidemic. And the editors, even the top editors at very large news organizations, they said to me off the record that they didn't have a plan in place for how they would report on an epidemic or a pandemic. They used phrases like winging it, meaning that if this kind of thing happens, what we do is we just send people out there and hope that they can do their job as best as possible. And that's really not appropriate, in my opinion. I think that kind of lack of preparedness, lack of training and resources is how we wind up with reporters who become infected with Ebola while trying to cover the epidemic so that we can be informed as their readers and as their viewers. I also learned that war correspondents, and many of you will be familiar with this, but war correspondents do get trained. Some of them get a 3-day training, in fact, on how to stay safe while covering conflict. Totally makes sense, right? You're sending somebody into a very dangerous area. They need to know how to protect themselves while they do this valuable work of getting us the news. But my question was, and I wrote an essay about this that you can find on Medium, my question was, why don't health and science correspondents get that same level of training? We're sending people out, in the case of Ebola, for example, in 2014, into places where there is epidemic spread of the disease, and we're expecting those journalists to put themselves in danger while getting us the news that we need to stay informed. And we saw that also with Zika epidemics, and we're seeing it to some extent now. It's not always just about the personal safety of the reporter, because somebody might have to, for many reasons, report at a distance from where the epidemic is happening. At that point, I believe it's so important that we have journalists who are well versed in the language of science, the language of epidemiology. The problem here is when we haven't trained people, they're starting at zero and trying to just get up to speed in the middle of a crisis situation, which is how you end up in situations where journalists aren't asking the best questions, aren't doing the best analysis of the studies that are coming out, or maybe they're reporting on studies that when you go look at the paper, they weren't even peer-reviewed articles. And that's how the public can also become misinformed. It's how you can end up with headlines that are sensationalized. It's obviously easy to point at news organizations and say, you got this thing wrong, or you need to issue a correction, or your headline lacked nuance. But we really need to take a step back and make sure we're supporting and training journalists. And I can tell you from having worked in a newsroom that, had a tight budget as many do, you would ask for time to go to conferences or to get training, and it often wasn't available. Those resources weren't there, which is why it made sense to have somebody like me who had that expertise in the newsroom. Not everyone can do that, but I think there is a basic level of training that we can have to make sure that in every newsroom, there are journalists who know some basic epidemiology, know even how to vet a scientific article to know that it's legit, it's solid quality or not before they report on it. And I think we end up with holes in our reporting, which leads me to my next question for you. So if we can bring that up. Do you feel like where you are, that could be Rwanda, Brazil, Peru, all the places, that your local news organizations are sufficiently reporting on vulnerable and marginalized communities? So again, about half a minute to give this some thought. Somebody's answering in the chat, no. Please vote as well as leaving your comments. Okay, I'll count us down. 5, 4, 3, 2, 1. Wow, so more than half disagree that where you are, your local news organizations are not, so you're saying, yeah, you feel like they're not reporting on vulnerable and or marginalized communities. So this is the final section of my talk. I'm going to speak on this issue. Then I'm really excited to get to the Q&A because I want to hear more about what you're seeing where you are and perhaps what lessons we can learn from that. So I've made this point initially that journalism is part of the public health ecosystem. It's how we keep people protected. You may have heard this term that a free press is the immune system of a democracy. And that certainly feels very relevant to me right now. Then I made the second point that journalists are often not supported enough and not trained enough to do a solid job of reporting on very complex public health issues and also keeping themselves safe. And that's what leads me to this third and final part of the talk, which is that if you're not supporting and adequately training journalists to report on these issues, you end up missing major stories and often sidelining those communities that are already the most vulnerable and marginalized. So during a pandemic, people keep talking about this as the great equalizer. The COVID-19 is the great equalizer. It's a virus. It's an equal access virus. Anyone can get it. I find that so incredibly frustrating because nothing about this pandemic is equal. Rates of infection in many places are not equal. I live in the US where we're seeing a disproportionate number of COVID-19 deaths in Black people and in people of Latinx communities compared to white people. What about that is equal? I've already mentioned the idea of health deserts, places often in rural communities, but not always, where people lack basic access to healthcare. They may have to drive really far, it may be expensive. We know that in the US, there are 27 million people who are uninsured and 44 million who are underinsured. So there's no equality in access to healthcare or in health in general. And I think what happens is when you don't have journalists who are properly supported and properly trained to report on health, that's how you end up with these frustrating headlines referring to COVID-19 as the great equalizer. So that's one way that we can fall short in journalism, by not properly supporting journalists. I think we also see very misguided journalism. So early on, even some very long-standing journalists who report on public health, who should have known better, were referring to this virus as the Wuhan virus. This was back before it had an official name, but those journalists should have known better, because they were covering epidemics before this one. And so they were well aware that the World Health Organization and other institutions nowadays have very specific guidelines for how we name viruses. And that's really important, because what you name a thing has an impact. Think back to 2009, when we had the H1N1 pandemic and people started calling it swine flu. Then we saw in places like Egypt, hundreds of thousands of pigs were slaughtered unnecessarily, because there was this connection that, oh, it says swine flu in the name, it must come from pigs. And it wasn't pigs at that point that were any harm to humans, it was other humans. That's how it was spreading. Because of those kinds of consequences, because of the xenophobia and racism that is exacerbated during epidemics, we have these strict rules in science about what to name and not name a virus or any pathogen. And unfortunately, instead of following that guidance, or instead of just waiting for the officials to name the virus, there were there were journalists who were putting in their headlines and in their stories, this is the Wuhan virus. We're seeing now the consequences of language like that. Also, the US president calling this the Chinese virus. The consequences of that is violence and racist attacks against Chinese people around the world. Here in the States, we're hearing so many awful stories of violence against Chinese Americans and people of Asian descent. I've heard those stories also in the UK and in Australia. I'm sure you've heard those stories too. So what the language that we use and what we call a thing has an impact. And we hope that journalism has an impact, right? It's why we went into the field. But we have to be very careful and very deliberate about the language we use in our stories. So I'm curious to hear more about your perspectives on vulnerable communities. Early on, when this virus was spreading, I was really worried about homeless people, incarcerated people, people living in those kinds of facilities like immigration detention facilities, where we know that there's already overcrowding, that there's poor hygiene and poor access to care. And we've started to see, I think, some more journalism on vulnerable communities, but I still think there's a lot to do there in terms of covering how this impacts marginalized people, how this impacts communities of color, how this impacts queer people, given we already know that access to healthcare for queer people can be very, very troubling and very difficult. And even once they are engaged in healthcare, there can be many issues. So those are just some of the issues I'm seeing raised. As I mentioned, I think we're starting to see more of that reporting, where I was seeing gaps initially, but it's still coming to me. It feels a bit slow, like we should have had our eye on that earlier. And to me, it's a problem that really reflects the lack of diversity in newsrooms. And people have gotten really angry with me on Twitter recently for talking about diversity in newsrooms and saying, we're in the middle of a crisis, it's any time to talk about being politically correct. And that's not the point I'm making at all. Like, who cares about political correctness right now? What we care about is producing top-notch journalism that reflects the people that we are reporting about. And if our newsrooms don't look like the communities out there in the real world, that's how we fall short. So in summary, as I wrap up, my 3 key points were that journalism is a crucial part of the public health system, which is why many refer to a free press as the immune system of a democracy. My second point was that I don't feel that journalists in many places are adequately supported, trained, and looked after so that they can do the kind of health and science reporting that is invaluable at times like this. And then my last point was that that's how we end up with big gaps in our journalism and overlooking important stories about people who are disproportionately affected by epidemics and pandemics like this one. So thank you very much for listening to me. Thank you very much for engaging. It's been really great seeing your responses. And I'll hand back over to Anne so that we can have a lively question and answer session. Thank you.
Thank you, Seema. And we have had a goodly number of questions come in. And also a comment from, shout out from Carol from Oregon, who does say that she has seen some good reporting on homeless populations. But that is the question that has come up in a couple of different, from a couple of different folks in our audience, in terms of how do we get the journalists to train for and focus on vulnerable populations, these news deserts that you've talked about. What type of training, whether prior to folks going into the professional journalism field or when they're already in the professional journalism arena, what do you recommend? And that's one question from Terry, for example.
So ideally, you would have newsrooms that have a science desk, right? That have, even if it's one or two dedicated reporters who know how to cover health and science. Unfortunately, as we've seen so many cuts to journalism, and I'm speaking much more here about the US, where I'm familiar with that field, we've seen science desks decimated, and often that veteran science reporter was laid off to try and save money in the newsroom. And in fact, you can look at what's happening right now, because newsrooms, like many other entities, are also really hard hit by the pandemic and are laying journalists off right now when I feel like we need them the most. The Dallas Morning News, obviously I keep a very close eye on because it's where I cut my teeth as a journalist, but they've had layoffs, and then they're also doing 30% pay cuts for existing journalists who get to keep their job. And if you are interested in this and want to keep an eye on the state of journalism, where are jobs being lost, where are pay cuts happening, you can check out the Poynter Institute, Poynter. They're doing basically aggregating and keeping an eye on this for us. So that's my ideal situation, that you have a newsroom that has a science desk and has people there who are well trained to cover these issues. If that's not the case, then what you are doing is sending often general assignment reporters who are having to really, really quickly get acquainted with a new field. My advice to you, if that's your situation, is take a moment early on. I know you're going to be on deadline, but take a moment early on to vet your sources really well. Find a few good sources, the kind who, when you ask them very broad questions, they're like, oh no, I can't speak to all those things. My expertise is just the tip of the spike protein of the coronavirus. Those are my favorite sources, the ones who are worried about over speaking to too many issues. Vet your sources well. Make your sources recommend other sources, and check out what those sources' peers are saying about each other. Do not fall into the trap of just finding the loudest voice out there, which is what we saw early on, especially in the US. There were some so-called experts on Twitter who are not really experts in this area, but they were saying very sensationalist things that were very kind of attention-grabbing, and journalists jumped on that. So if you don't have that luxury of a science desk, you don't have that luxury of having reported on health and science for a long time, do that groundwork early on of finding a few key sources who are credible, who are reliable, and who lead you to other good sources. I will say really quickly, have been before this pandemic, developing a tool that journalists can pick up and use to train themselves before they head out into the field to cover an epidemic. So I really want to make sure that people are safe. One thing that I noticed was, if I was going to West Africa to cover Ebola as a journalist, I felt quite protected or supported doing it because I'd had training outside of journalism as an epidemic responder. So I'm trying to create this online training module that helps you understand what kind of personal protective equipment you need, what you need to understand to keep you safe. So I hope that answers some of your question. It's a tough situation when there are people losing their jobs right now, and we need those people in newsrooms.
And that tool, I know there were a couple of other questions in terms of even a checklist that individuals who haven't covered public health situations before, where they can go for that information. So we'll be sure to share that out going forward, and any other information that's available. A related question from Michelle is, do you have any particular resources that you recommend for how to evaluate the quality of a study beyond just looking at issues of, is it randomized, is it placebo controlled? What would you recommend to journalists on that score?
So I know one of the first things we do is we pick up the phone and call one of the lead authors on the study to talk us through some of it, to answer our basic questions on the study. I also like to ask them, that source, who is critical of their work. And a good source will tell you, oh, I have this colleague who really criticizes my models and the way that I do this assay. talk to that person. That's also another way of vetting a source, is that if you call a lead author and they're like, there are no limitations of my study and there are no flaws, that's a really big red flag. A good source will say, well, they'll be quite on the fence, actually, in a way that's quite frustrating to a journalist, because you want them to be very conclusive, and they'll be like, well, we think the study shows this, but it's not causal, it's more an association, and it could change with this and that. That's a good sign of a source, as frustrating as it is. But in terms of actually looking at the paper and saying, this looks solid, it looks like it was definitely peer reviewed, and the methods look great, then I think asking the sources themselves, who are people in your field who you respect, who can offer me a good critique of your work as well.
And in terms of the critiques of work and maybe even more collaborative work, just to follow on that, I'll mention again from some of our friends out in Oregon that there's a statewide collaboration among media, different platforms, TV, newspapers, radio, online, sharing stories in particular on coronavirus. Sounds very similar to some of the work that Pulitzer Center is trying to do to support these collaborative projects. So you're building on each other. So if you might not have a public health focused journalist in your newsroom or in your sphere, if you're not a journalist and you want to see how others can collaborate on these issues. Question regarding just in terms of working with communities in underserved communities in terms of language situations and reporting, trying to get into a community. That how do you recommend if individuals reaching out, if they are not familiar with the community, trying to get their stories on these issues out beyond just kind of the local smaller news agencies that might be within a community, or maybe even that they don't even have a community newspaper either in their local language? Do you have any suggestions for individual journalists who want to try and reach additional communities that they're not as familiar with?
Yeah, great question, because we need to be doing that work and bringing those stories to many more readers and viewers. I think the straightforward answer to that is to seek out gatekeepers in the community, thinking about imams or chaplains or community leaders, activists, who can be a good point of contact to then initiate interviews with other people in the community. And that's a straightforward response because it's more difficult than that. And I think it should be more difficult than that. Imagine we're talking about communities that often don't have a good history of interactions with the press, who may have been misrepresented many times in the press. So we have to do a lot of groundwork, I think, to prove ourselves, to be respectful, to acknowledge that history and that context, and to realize that I know it's the middle of a crisis and we're on deadline, we need to be quick, but some of that work, I mean, we should have been doing it a long time ago, right? Like building those inroads into many, many communities. It is still possible, but it will take time and lots of research and lots of acknowledgement of journalism's lack of good relationships with some of the most marginalized people in our societies.
And this is quite a conversation we're having also with in the Q&A. We're looking through, now we have a good couple of dozen questions coming, so I know we probably won't be able to get to all of them, but we're trying to synthesize and get your questions to Seema. So one of the other areas in terms of training and empowering the marginalized communities to tell their own stories. This is from the International Storytelling Center in Tennessee, in terms of, is there a way for journalists perhaps to work with communities so that they can also tell stories and get the information out there? Do you have any suggestions on that?
Yeah, I think citizen journalism can be really effective. I think we have to be careful how we do it in terms of training people well in working in partnership, not going in and dictating what the stories we think should be told. I've seen that happen so many times, even with like the most well-meaning, and I actually hate that phrase well-meaning because it's often linked to something that was poorly thought out, but where people are like, oh, here's a community that's underrepresented in the media. We think the biggest issue for this community is, and it's like, no, stop. Take the time and really listen to those folks, which is what the groundwork of journalism really should be. There are, I think, some organizations who are doing this really well. I want to say, is it the Block Club in Chicago? I'm blanking on some of the names, but you can start looking up and seeing in different places, where is there good kind of advocacy journalism happening? Where are journalists making very meaningful connections with underrepresented communities and listening to those people, you know, kind of passing them the microphone instead of speaking for them?
And there are a range of journalism organizations themselves which are pulling together different journalism professionals from different backgrounds. So that may be another area: Asian American, Black Journalists Association, Hispanic, and so forth, in terms of getting more connections.
Yeah, and just to add to that, Anne, you know, I paint this bleak picture of journalism right in this moment, especially where there are job cuts and pay cuts. But oftentimes, you know, in journalism, we really lament like the loss of local news organizations. We lament like the pay cuts and the layoffs and all of that. There are people I talk to, whether it's people in Black communities or in Muslim communities, queer communities, who are like, well, good, because journalism has been broken. So we almost need to like raise it to the ground and start anew and build a model that really is inclusive. And I think when you hear that, you're like, yeah, there are communities that have had terrible histories in terms of their interactions with the press, not being represented, being misrepresented. So it's something to keep in mind that during a crisis like this one, those issues are usually only heightened.
Flipping that a bit in terms of, we're talking about the journalists, individuals who are going into the profession of reporting. What about someone who comes from the other side, from the medical community, from the public health field? What resources or suggestions would you have for someone with that background who is interested in journalism? That's from another one of our audience members. What would you recommend to that person?
So there's so many different ways of going into journalism. I think there's not one route, which can be both frustrating, but also brilliant. Some of my favorite science journalists don't have science degrees, and in fact, don't even have journalism degrees. So I teach journalism. I'm always telling my journalism students that it's really important to be out there, to live your life, to build expertise in different things. If you already have that, I can definitely recommend the program that I went through at the University of Toronto, which is a very special journalism program that takes people from different skill sets and backgrounds who already have expertise in a particular field, and then trains you on how to report the news in your field. So not to write op-eds, but to really do that work of basic journalism. But there's also internships in newsrooms are some of the best ways to cut your teeth, I think. And then you can write op-eds. You know, we have the luxury nowadays of everyone can be a publisher. So, and also making yourself available to journalists in your community, building those relationships and networks so that journalists have credible sources like yourself.
And regarding sources, I think that is a concern of some of the individuals in our audience in terms of the loss of veteran journalists who have left many newsrooms. The training may not be as up to speed, perhaps, some concerns there. So how do we combat that situation, both from the inside and outside? And following up on that, there have also been questions of, how do you combat misinformation when it's coming from the podium of a press briefing, or when it's coming from other types of policymakers and political leaders? So a two-part question that a lot of folks have been putting into our Q&A today.
Yeah, thanks, Anne, for those very easy questions. I can just answer them in a couple of seconds. I think that's so difficult, right? And I myself saw the loss of veteran journalists in the newsroom I worked in, and then replaced with younger, cheaper journalists. It's really, really tricky. And at the same time, many of us have empathy with the news organizations, at least maybe a bit, that are just trying to stay afloat, trying to get the news out there. I don't have an easy answer for that. How do we fix that? I mean, that's what journalists spend a year trying to think about in that JSK fellowship. Like, how do we save the model of news? I think we need a different model in some instances, maybe especially for local news. So I'm afraid I don't have like a a quick fix answer for you if I did. I was going to say I'd be rich if I did, but I wouldn't, because it's journalism, so none of us is going to get rich doing anything. But I worry about that a lot, because we lose institutional memory, we lose the memory and the big sources, in fact, the source list that many of these veteran journalists have. So no easy fix for that, but I think we should all be thinking collectively about how we counter that. And I think that almost plays entirely into the second part of that question around countering misinformation. The reason you need veteran journalists and experienced journalists and journalists with good training and good sources is because those are often the journalists best placed to counter the misinformation that's out there. They've seen it before, often they know how to deal with those false narratives. It is very tricky in that it's coming from the highest levels, and we are seeing with this misinformation and disinformation that it's having direct consequences that we're measuring in real time. I'm sure many of you saw last week in the US, I think it was last week, time is blurring a bit. I think it was early last week, we saw a man die in Arizona and his wife end up in the ICU because she said to the press that she had heard the president of the US say that there was a drug called chloroquine and you could take that and it would treat COVID-19. And they had some in their house, but a formulation that was meant for cleaning fish tanks. And they both took it and he died and she wound up very, very sick. That's what we're up against. And so we are listening now to some news organizations saying, right, that's it. We're no longer live streaming the White House press conferences, because what you're seeing during those is the president, other officials just say things that aren't scientifically accurate. And then another person comes up to the podium, an expert, and has to counter that. It ends up so confusing. I think as journalists, you know, when I talk about being deliberate about our language, that comes into place here. I think we have to be very quick and very honest about what is factual, what is inaccurate, bearing in mind the consequences of these mistruths can be death for many people.
And building on that, I did hear another journalist who leads an investigative reporting organization who said, as journalists, we don't just wait for the press briefings. We have to get out there and look into this information ourselves and dig and go for those sources. One question, and again, this is a larger picture one, is how do you think the COVID-19 pandemic will change the field of journalism going forward?
Right now, I think I'm feeling sad and grief and, you know, from both losing friends from this disease and then also hearing from friends who are amazing journalists telling me I've just lost 3 months rent because of these pay cuts. So I really worry about the future of journalism. I do try and be hopeful, and I do try to seek those glimmers of optimism and hope where there feels like so much despair. And so in terms of journalism, I go back to that point I just made earlier, Anne, that we had a model. Yes, it worked for a time, but actually it only worked for some people. I remember when I was at Stanford in that fellowship, we had this veteran news journalist from like the 80s and 90s come and talk to us. And he was like, you know, journalism is broken now. We need to make it back to how it was. And I was horrified thinking, wait, the journalism that you're celebrating back in the 80s and 90s was overwhelmingly white, was overwhelmingly male, was so Western centric. We don't want to go back to that either. And I think that in terms of the pandemic too, you know, as many of us are sheltering in place and dealing with this new normal, I keep getting asked the question as an epidemiologist, when can we just go back to work? When can things go back to normal? And I think that if normal was the set of conditions and systems and circumstances that got us into this horrific mess, I don't want to go back to that normal. I want to create a better society. And that better society needs to have a better version of journalism too, a more sustainable one, a more accessible one where there aren't news deserts, one where there are newsrooms that are diverse and where the journalists are well supported to do their jobs. So yes, there is lots of anxiety, grief, and despair, but we need to think very optimistically about the future and actively, how are we going to rebuild? How can we rebuild in a way that's better and more sustainable?
Well, I think that's a pretty solid way to wrap up for this session. We have a lot more questions. I know we'll try and get some information out to folks. They've asked some information with more resources that they'd like to have. This issue on health deserts and news deserts. They're really looking for some more information on those, if there's any research on that. And we'll attempt to share some of that perhaps afterwards online. And I really want to thank you, Seema, and thanks to our audience today for all of your interest and your questions, and to our colleagues at the Pulitzer Center. We want to let you know that this is just the first in a series where we're trying to be talking about some of these key issues. And if you stay with us a few more minutes longer, we also want to remind you that there's a brief survey that will pop up at the end. Next week, we'll have Science Magazine senior correspondent John Cohen with us on April 16th. Pulitzer Center is supporting the COVID-19 reporting by Science Magazine, and John will focus on the hunt for a vaccine against coronavirus during our conversation, as well as talking about other aspects of his reporting. So please join us next week and share widely. Also remember that we're a nonprofit journalism organization. As such, we depend on your support and support from donors, individuals, and others. More on our reporting and upcoming events and how you can support the Pulitzer Center also can be found at pulitzercenter.org. So thank you again, Dr. Yasmin, and thanks to all of you for being with us today. Have a good afternoon.
Thanks, everyone. Stay healthy.
Stay well.